COVID-19 update briefing for Friday, October 23rd. Today marks our fifth conversation since we returned to daily briefings last Monday, and we've seen upward movement in our COVID-19 data for each of the last 5 days. Last Monday, our lowest positivity was Region 11, that's Chicago, at 6.2%. That was Monday. Today, Chicago is now tied with Region 2 in north central Illinois at 7.0%. That's a 0.8% increase in just 1 week. Chicago's infection rate is rising at a rapid rate, just like the rest of Illinois. Statewide, the number of patients hospitalized with COVID-19 has increased 17% over the last week alone. As of Monday, only one of our 11 regions have been moved into increased mitigations of our resurgence plan. Today, that number is up to 4 regions: northwestern Illinois, southern Illinois, and Will and Kankakee counties, that's Region 7, DuPage and Kane counties, that's Region 8. With Region 4, Metro East, crossing the 8% average threshold for the first time today, or at least since the last time they were in mitigation, and Region 9, Lake and McHenry counties up on the Wisconsin border, close behind with a 7.7% average as of this morning. Regions under tighter mitigations sometimes take more than a week to see the numbers start to level out or come down, but it happens quicker when people in a region make personal efforts to follow the basic mitigations immediately. What we do today, October 23rd, will determine how many cases we have and what our hospitals will look like on Halloween, just 8 days from now, and at Thanksgiving, just 34 days from now. Following public health recommendations, especially wearing a mask in public, will bring our numbers down, save our economy, and let more of our kids go to school, getting us as close to normal as we can be until we get through this. And here in Illinois, we continue to do everything we can to slow the spread of the virus and move us toward that normal. Every day of the last 8 months, we've gotten better at tracking and monitoring this disease through more and more testing, making sure that your individual efforts to protect yourself and your community are matched by our efforts in government. Ours is not one of those states that started to build up its testing infrastructure in March and then slowed down in July. Illinois now has surpassed a 70,000 test per day average, which means that we test 3.5 times as much as the average state, and we're third in the nation in daily testing and number 1 in the Midwest. Each day we do more testing at our 26 state-run sites and 3 IDPH labs alone than most of the states in the United States do. In every state where they combine state sites, private sites, hospital sites, doctor's offices, and anywhere else, we're exceeding those in a combined basis, just in our 26 state-run sites and our 3 IDPH labs. One of the key elements of our testing success is that we have built a mobile testing system that can be deployed anywhere in the state, with an emphasis in areas with documented outbreaks and increasing positivity rates, and where local public health departments indicate that there's a greater need. Decisions on the location of mobile testing sites are made in part on the submission of mobile testing site request forms on our IDPH website, where anyone can submit an area of concern for consideration. From there, IDPH works with our mobile team operators to evaluate all the information and to get our teams across the state in as equitable a manner as possible to urban and rural and suburban communities alike. In the last 2 weeks alone, we've had mobile teams present present in 47 counties throughout the state of Illinois. These tests are free to anyone, regardless of citizenship, symptoms, or contact with someone with COVID. And they're also fast. I know that throughout this pandemic, there have been national headlines about the long backlogs, sometimes 2 weeks, at commercial labs, national ones, that delay you getting your test results. Well, that's not the case at our in-state, state-run, community-based testing sites and our mobile sites. The majority of people who go to these state-run sites see a turnaround time for their results in 2 to 3 days. And for many, it's even faster than that. This is key because the tests that we offer at our state sites are PCR tests, the most accurate kind of COVID-19 diagnostic test out there. You can find the closest one nearest to you at dph.illinois.gov/testing. Mobile testing has allowed us to evolve where and how often we need to offer testing in a certain area and increases the availability of free testing as needed. Next week, for example, we're piloting a month-long, semi-permanent, 7-day-a-week operation in Mount Vernon in Region 5, Southern Illinois. And we are currently identifying locations in Region 3. This is the work that it will take for us to get through this. And let me be clear, we will get through this. Our strong testing regimen is just one important tool in our toolbox, and we didn't have that toolbox prepared when this pandemic first hit. No one did. And there are others that we have deployed, which we will talk more about next week. Navigating new challenges with Illinois ingenuity and grit is who we are. From expanding testing for everyone, everywhere in our state, to calling on the Republican-led U.S. Senate to get federal support for our Illinois small businesses, we won't stop fighting for our state and for each other. We've got to be all in for Illinois. So now I'd like to turn it over to the Director of the Department of Public Health, Dr. Ngozi Ezike.
Thank you, sir.
Thank you.
Good afternoon. I do want to say happy Friday, but I understand the mental, the social, and the emotional toll that this pandemic continues to have on people. It's not just because I'm asking people, it's because I'm feeling it and living it myself. I don't get to live in some COVID-free bubble exempt from all the pain and the tragedy of this pandemic. So I understand how pandemic fatigue is striking everyone. It's real. People are tired of not seeing their families. They're tired of postponing the weddings and the other life celebrations. Trying to work from home while also trying to manage kids learning on remotely is a challenge, not being able to visit your loved ones in long-term care and nursing homes. Not being able to gather with groups of friends for a night out in your favorite restaurant is getting to be a lot to bear. The way we work, the way we live, the way we play has all changed, and the harsh reality is that the sacrifices we've made and that we continue to make do not have a future expiration date. And I know that that's difficult. This new virus has caused this horrible situation, and although people want to refute the number of cases, we are seeing the number of people with COVID-19 continue to increase. We are seeing the number of individuals in the hospital because of COVID-19 increase. We are seeing the number of lives lost continue to increase. And if you're tired of hearing it from me, please just ask one of your local physicians in the area. They will tell you what they are seeing in their hospitals. Since yesterday, we lost an additional 31 lives for a total of 9,418 deaths. These are people who started with us in 2020 and won't be with us at the Thanksgiving table. Today, we are reporting 3,000 874 new cases, for a total of 33 confirmed cases since the start of this pandemic. Excuse me, please.
Get it. Come on up. Thank you.
I'm sorry. Okay. We have had 364,033 cases since the start of this pandemic. 2,498 individuals were reported to be in the hospital overnight. Of those, 511 COVID patients were in the ICU, and 197 patients were on ventilators. In the last 24 hours, 82,256 lab tests were reported for a total of more than 7.1 million tests. My message to you is to stay strong. I've never run a marathon, but I have the utmost regard for those who've been able to train and plan and finish a marathon. But this is a difficult race when you can't actually see the end point, and I'm sorry that that's the message I have for you. Nevertheless, I'm asking you to fight the fatigue. Fight the urge to give up on social distancing. Fight for your kids to have safe, healthy opportunity to have in-person learning in school with teachers who were trained to teach them in the classroom. Fight to have safe, healthy environments at which we can work, so that businesses can remain open, so that our economies can start to thrive again. This does mean wearing your mask anytime you're around people. This means reconsidering that large gathering, that large social event. It means thinking about wearing masks in your own home when you're with other people from outside of your household. Think about connecting with friends and family virtually. This is what we'll have to do to bring the spread down in our community. When we bring the spread down in our community, kids can go to school safely, people can go to work safely, activities, family celebrations can be celebrations instead of super spreader events that result in disease and death. Let's please work together. I know many of you are healthy and don't have a concern in the world of dying from this COVID. I would say that, of course, there are some people whose chances are much lower, but let's please think beyond ourselves and think about the people that we could unknowingly infect who may not be as fortunate to have the immune system and the healthy status that you may have. We literally have people who are asymptomatic, meaning have no symptoms for the entire duration of their illness. And so for those 7-8 days that you may be shedding the virus, you are unknowingly, unwittingly infecting people in your path, people who will never know that they were exposed to you, but may come up with disease and maybe even be hospitalized and even worse without ever understanding where or how they contracted this. This is how this disease is happening, but we do have a choice. We can limit our gatherings, we can wear our mask, we can wash our hands, we can do these things so that we don't hurt those around us.